This podcast should not be used as a substitute for medical or mental health advice. Individuals are advised to seek independent medical advice, counseling, and/or therapy from a healthcare professional with respect to any medical condition, mental health issue, or health inquiry, including matters discussed on this podcast. This is the Living in Mid-Bloom podcast, lighthearted and heartfelt conversations about what it looks like to live, heal, and blossom in middle age. I'm your host, April Pruitt. Let's get our bloom on. Hey, mid-bloomers. It has been an interesting few weeks, to say the least. I hope you all are doing well, and I want you to listen closely to this podcast. Of course, I want you to listen closely to all of them, but this involves actually two traumas I experienced. One has to do with an ongoing issue with respect to trauma I experienced as a child. And then the trauma I had when I had what is called a TIA, Transient Ischemic Attack, or what they call a mini stroke. Now, it's not a stroke at all. If you have a stroke, that means some of your brain tissue has died. I don't know why they call this a mini stroke, because to me it's confusing. But an MRI was performed to confirm no tissue had died. Now, as you listen further, I'm going to be talking to my neighbor and friend, Victoria. I call her V. And she and her husband were the first two people who saw me when I was being taken out of my house. So we were all thinking the worst, that I had a stroke. But again, after going through tests and different processes and a long conversation with my doctor, that was the ultimate outcome, which I'm grateful for. But now the chance for me to have a full-on stroke is 1 in 3, and a possible stroke occurring within a year. A lot of this has to do with stress management, anxiety. It seems like anxiety is running rapid in our society right now. And, when I talk about past trauma, and if it's trauma that you have not fully healed from, it can resurface. And that's what happened to me when I was in the ER. I vaguely remember what happened. And as I continued to speak with my spiritual coach, I was able to get clarity on what exactly happened, because I disassociate when I feel I'm in a situation where I'm in danger, I'm frightened, and I can't protect myself. And what my mind is used to doing is disassociating to protect me. That's what happened when I was a child, and that's what happened that day that I had the TIA and I was in the ER. So past trauma, some new fresh trauma, old scars, resurfacing. It was a lot to take in, and I understood then why I had needed really some time to take a breath and focus on my mental and physical health. And I want to take this time to say thank you to everyone who sent me well wishes and prayers and kindnesses. And John, thank you for making that beef stew for me. And V, thank you for taking care of my kitties for me. Greg, thank you for not caring what the EMTs were doing and busting in to see what the heck was happening with me. All of these things I'm so grateful for. Such gratefulness I have, including my spiritual coach, everybody. I could sit here and try to name everybody. So here I am with my friend Victoria V. She was instrumental in helping me get through this whole process of getting my head around what happened to me. And I'm very grateful for her. Hi, V.
Hi there.
So I want to start talking about the night that this all happened. You were home, thank goodness. You and Greg were home. And I was working on my computer trying to figure out how to use this new software to organize all my stuff. And I was munching on some popcorn. I was listening to some Stevie Wonder. And the time was probably about 8 because I knew the exact time that I had called 911. So I'm sitting here, the cats are sitting around, and I started feeling some tingling like on my chin and around my mouth, which was strange. At first, it felt like it was an allergic reaction to something, but then it got stronger, and then it started feeling more numbness. And I was, again, I'm feeling anxious, but I'm still trying to understand what's happening. Then I started feeling it in my shoulder, down my arm, down my leg, and scared the crap out of me. And for about 20 seconds, I sat here thinking, it'll go away. This isn't really. And then it started getting worse. Then I thought, okay, I have to call 911. Where's my phone? I have my phone. And then I thought, how am I going to get my door open for them? It's locked. So I tried to get up a couple of times. I sitting right where I am in my living room on my couch and trying to pull myself up with the furniture. And then I just fell and hit the back of my side table. I start crying. I was able to slide my way to the front door and get it open. And then, I'm crying during all this. I call 911 and I tell them I need an ambulance. I'm struggling with feeling. And she took my, first name, took the address, and she's trying to get me to stay calm. It's okay. You're okay. I'll be on the phone with you until they get there. She's just asking me, does anything hurt? She said, it sounds like you're able to talk. I said, yes. I said, it feels numb, but she says, okay, you're sounding normal, understanding that you're feeling the numbness. And so, I hear the ambulance coming, and one of my cats is Allie. She's like, crying, what's going on? It sounded like there were like several ambulances, but it's just one. I see the lights, 2 EMTs come in, and I'm crying. They're like, you're going to be okay. We'll take care of you. You're going to be all right. And then understanding that I was leaving my house, I said I need my purse. My keys are on a table by the door. Got my keys. And I said, I need my neighbors. And they said, well, let us get you out of here first. And then I'm making jokes like, oh, I bet you can't pick me up, and I'm sure they must be used to that because they picked me up. They put me in one of those chairs. They were also doing all the tests, like, look at us, can you smile? Can you lift your arms? All these different things, signs of a stroke. They want to make sure, did I not? And then I kept telling them, I need to get my neighbor. I need to give them my keys, watch my cats, to lock my doors. And your husband, Greg,
Yep.
was right there, and I said, Greg, here are my keys. He's like, okay. He said, what happened? What's going on? And I either said, I felt, all this numbness on my left, or I think I had a stroke, and I could see the look on his face. The look on his face is how I felt.
Yeah.
Is, oh my God, what's happening? And I know you were telling Greg.
Well, in the meantime, going back a little bit, because of course we heard the ambulance coming. Yeah. I was back in the bedroom reading, and he says to me, "Oh, did you call the police on me?" Just joking. And I said, "What are you talking about?" He goes, "My gosh, the police. I mean, the ambulance. There's an ambulance over at April's." So I run out of bed and he's in the doorway with the door open. I literally pushed him out of the way and went running down the sidewalk. And that's when the ambulance had just gotten there. And they're going up your sidewalk. And immediately my husband goes over into your front yard. Well, all I could think about was, give her some space. Let's see what's going on. But he did the right thing. Because later when I talked to him about it, he was like, I wanted to hear what the EMTs were saying. And
Yeah.
because we know that, there's little family that you have. And so at that point, then he's standing there and I'm standing back a ways waiting to see if there's a time I can talk to the ETs. Well, he just busted in there and talked to them.
Did he?
Yeah, which I guess is what is needed to do, but
Well,
you
but you don't know what state I'm in either. I mean,
and you have to give the EMTs room to do what they needed to do, and I wasn't quite sure.
Yeah,
I was more about observing for a little bit. He was in there.
Yeah,
but then they did lift you out in that sit chair.
Oh God!
And then
it was surreal.
And you started getting worse as time went on, from the time they got you out of the door to the time they got you into the ambulance. But in the meantime, you were able to hand Gregory your keys.
Handed my keys, made sure they gave me my purse. I was getting worse.
Yeah, you were getting worse.
I don't even remember.
More, I know you were getting more incoherent. So by the time,
oh my God, I was.
Yeah, by the time they got you into the ambulance, that's when I followed, because they put you from the little sit chair and then it came up to a gurney.
Right.
And then they were getting you into the ambulance, and I followed out to that door. And I just wanted you to know, I've got your keys. I'll look after your cats.
Did I thought I said thank you. Could you understand me?
No, we were both crying.
Yeah.
So,
that's true.
Then they took you away.
Yep.
But we had your keys.
Yep. You could watch the kitties, because I know.
And lock your house back up.
Yeah. That was my biggest concern, though. I guess my health should have been. But I let them know, what hospital to take me. And, as they're checking everything, they're telling me, your blood pressure is 212. He said that is very dangerous. He said that could really potentially cause some serious issues. And so the ride to the ambulance, to the hospital, everything is just fuzzy. Mm-hmm. I didn't want to go. The thought of having to go, and the thought because I have something serious, I was not into that very much. But
yeah, but one thing you forgot to mention is that, because you told me this later, that when all of this numbness first started, you thought about, I'll call Victoria, but then you were like, well, wait a minute, what can she do?
Yeah.
So then that's when you realized, I have got to get up and unlock this door.
Yes. It was kind of like, I don't really want to deal with this. Maybe they'll come over and then maybe I'll be fine, like a few minutes from now. And I'm glad I did not do that. I'm sure a lot of people do that want to deal with it and think, well, I'll just wait and see what happens. And if I had done that, then honestly, I don't know if I'd be here, because then I wouldn't have been able to tell anybody anything or call or.
Well, and this brings up so many issues, because, my husband immediately after you left was like, well, now what do we do? How are we going to know who to call? And then now you and I have since talked about all of the things that need to be put into place.
Got to get you a set of keys, got to give you important contacts. Mm-hmm. All of those things you don't take too seriously, because, I'll be fine. And then when I need to do that, I'll do it. Yeah. It won't be an emergency, but.
Oh, you're not alone in that. Who wants to think about those things?
Yeah. Yeah.
And it depends on what your family situation is and your living situation. each one of those is different. I mean, I know when I was still working in hospice, if we had a patient that lived alone, which we had that happen on many occasions, we had to put certain things in place.
Like what?
Like having a key to their place, because it depends on where you live. But there's all kinds of issues we could talk about. But the police won't necessarily just break into somebody's house. Depends on the municipality you live in.
Oh.
And so we, being the social worker in that situation, I had to come up with protocols, what to do if we had a patient that lived by themselves and their next of kin, for example, maybe lived out of town. That's when you start thinking about those things. Well, that's because once somebody's on hospice, they know that their situation is going to decline. Well, we don't all have that ability. Right. So you need to do it before something happens.
Yes. Yes. And, I told you I'd see my attorney next week for some other things, but we had started the paperwork for power of attorney, trust, the healthcare directive, all of those things that I know that I have to think about those things and make some important decisions. So I'm in the ER, and I know the timing because, like I said, it was on my phone, but they kept keeping track of the time. I know there's like a certain time limit that they can, I guess, determine a stroke and be proactive. So I'm just kind of there. I vaguely remember anything except I know that the nurses were very nice. The doctor was awesome. They kept checking my numbness level, kept giving me these tests, smile, put your arms up, push against us, pull again, all of these things. And I think probably after the third hour, all my numbness was gone. It was all gone. I was able to actually get up, though they wanted to keep an eye on me, to go to the bathroom, give them a urine test. I've got all the needles and everything in me, giving me fluids. The main issue at that point was blood pressure. And they have to get it down, but they have to get it down slowly. There's a certain, they can't do it too fast. And all of this is happening. And, as I was telling you, that there were some things I really didn't remember when I was talking to my spiritual coach, because I've been doing a lot of crying. Of course, it's, I was scared. I was fearful. It was, how am I going to deal with this? I've got to change, the way I take care of myself. But somewhere in my conversation with her, I remembered something that I had forgotten. And it's like an out-of-body experience because I do disassociate at times when I'm very fearful. And I do remember at one point crying and telling the nurses that I needed to see the doctor. I was very firm about that. They're like, well, can we? I said, no, I need the doctor. Another nurse came in, I need the doctor. So he finally comes in, I'm crying my eyes out. I tell him I'm scared. I tell him about the trauma I experienced as a child. He's holding my hand and telling me that I'm safe and that I didn't have to worry about anything, that they would keep me safe.
And they really responded to your fear, didn't they? Which is amazing.
Yes. He was awesome. He sat with me, for a few minutes.
Yeah.
And then, they were coming in to do other stuff. And, I almost didn't remember it because it really was so traumatic, and then it's bringing up old stuff. And I guess my understanding now is that occurs when you're going through a traumatic experience and it reminds you of something you dealt with in the past. Those same feelings and fears come up and you experience them.
Yeah. So not only were you like experiencing the scare and the trauma you were currently going through, but it brought back all the other trauma.
Yeah, it did. But I was grateful. I had really good people working with me there. I was still in the ER.
That says a lot for the emergency room.
Yes.
because they're,
Yes.
they're always so busy, and that they actually took the time, and you felt like they took the time.
Oh, yes.
Wow.
I think I told you I'm trying to find that doctor. I emailed my doctor and I said, I need to find the doctor that was there for me. And I need to find, there's a nurse once I got a room that was fantastic.
Oh, wow.
I mean, everybody was good, but if you talk about outstanding,
Yeah.
I need to let those folks know it's important to me.
Mhm.
I was still in the ER when I sent you a text, that they don't think I had a stroke, that it was high blood pressure. Yeah, it was almost midnight. And then I didn't get into a room until like 5 in the morning.
Oh, gosh. Yeah, of course.
So, you're wearing these, little thin things, gowns, but they bring you, warm blankets. So, got in my room. Honestly, I was so tired because, they're constantly poking you and you twist the wrong way and something buzzes.
Yeah.
But so what? That was Sunday. It felt like a long time because I was there 2 nights. And I know every day I wanted to go home, but I mean, I obviously,
So you were there 3 days and 2 nights, because you got there
that is
Saturday
correct.
night. Yes.
Is that what that is?
Yeah. So also, since you sent me that text at night and I didn't see it until in the morning, so I wanted you to know right away that the kitties were okay.
Yes.
So I went over early because I knew they'd be wondering too.
Yeah.
And so I went over, and then I was able to let you know that they were okay and your house was okay. And
this part, V is working toward getting me to talk about that trauma that raised its ugly head, that old childhood trauma, and how I responded to that. And again, I didn't really remember it until I was having a conversation with my coach and going to different therapists. And it's a hit or miss as far as I'm concerned. You really have to spend time finding someone who can really, really help you for what you need at that time. And I know that I've disassociated most of my life, and other friends have seen it happen. It's been a few years since this has happened, but once I was able to recognize it helped tremendously because it's really scary. It is a real medical condition. And again, it's a way and I'll say in most cases, it's children who go through long term physical, sexual, emotional abuse. And that's what you do to protect yourself. And so that's what I was doing when I was in the ER. Like I said, I did find that doctor who was very instrumental in helping me get through that process. The other part of this is when a friend sent me that article by Tina Turner, and that she had risked her life by not following her doctor's instructions or decided to stop taking her medication for thinking that, as healthy as she felt and alive, your kidneys will fool you until you start having symptoms. And she was hoping that her kidney would be fine. Her kidneys would be fine, and that wasn't the case. She was off the medication and taking a homeopathic direction, and it did not pay off for her. I am, like I said, going to include an article about her. All of this to say that, stress and anxiety can really cause health and mental problems to arise. I mean, it happens. And I know the extra stress I have in my life played a part in the TIA I had. And so all of these things I'm trying to turn around, and which I will continue to talk about this year. And I will be talking to someone who had a stroke about a year ago, and she's doing fine now. But I want to talk to her about her journey and how she's doing and how she's recovering.
okay, so I'm sitting here listening to you, and I'm hearing all of the details about what happened, and it's good information. And But I want to circle back to something, April, because I'm sitting here thinking about how important it was when you were talking about being in the emergency room and how that brought up so many fears. And I just want to be clear because it's so important. A lot of us know people that have had trauma in their life, and you've alluded to the fact that you had trauma in your early years.
Yeah.
And I know you're going to be talking about that at some point.
Yeah.
But what I think a lot of people don't think about is, well, what does that really mean in your adult life? And what sort of things trigger memories like that? And obviously, what happened to you was a huge trigger.
Yeah. Yeah.
So you're in the emergency room, and here I'm going to back up even a minute more because you said you were talking to your spiritual counselor, and you said you almost forgot, but she must have been going through the timeline with you of what happened at this event, this medical event.
Yeah.
So you start talking to her, and all of a sudden you're remembering, oh yeah, I was in the emergency room. And I bet even just talking about it right now, your heart probably started palpitating. So you were in the emergency room, and for some reason you started feeling very unsafe.
Yes. And I didn't realize what was happening. So I've been diagnosed as having this dissociative amnesia.
Okay.
Which means that there are times in my life due to trauma that I disassociate. It's like my mind is protecting me from something that happened until hopefully I'm ready to deal with it and heal.
So it's a coping mechanism that you've developed.
That's my understanding. I mean, therapists I had seen years before, I would even say, I think I have an issue with dissociating. And this therapist, which I ended up suing and winning, was dead wrong. I mean, it's a real disorder. And from my own experience, knowing that there are many things that I don't remember, or I remember a little bit, or somebody tells me. And I had only started actively dealing with the abuse in 2013.
Which is the trauma you're referring to when you were young.
Okay. I was digging, and I asked a relative about something, and they said, I thought this might come up. And so that person confirmed a conversation that we had when I was 10. And so once it was actually really confirmed is when, I really start thinking about it, but it's taken me a long time. And I'm clearly, because of my response, I still have trauma that needs to be resolved. Mm-hmm. It's still there. It's still there, in my body and in my mind. And I just need to keep working through it. Mm-hmm. Things like this, I won't say that the trauma never goes away, but you can live a full life and enjoy it. But what happened in your past doesn't disappear. It's there, but you have the tools. You know how to work with it. If you've found the right people to work with,
Well, I think it's interesting that you said the trauma is still there in your body and in your mind. So sometimes you actually have physical responses.
Oh, absolutely.
Obviously, that happened to you when you were in the emergency room.
Yeah. Sometimes I get reflux, and I started feeling that there, even though it wasn't like I had anything to eat or drink to cause it. But it's when I get anxious that happens. Or I'll get stomach issues if I'm anxious. Or I'll feel like I have to throw up, and I have to work myself. I have to calm myself down because I hate having those episodes. And so I've been able to calm myself down in those moments when I feel like I'm going to be sick, and then, to release it, start crying to release it. Mm-hmm. But it's a whole process.
Well, how did you get to be able to perform, quote unquote, the process that you use? Is that through therapy or?
Yeah, being present is probably the biggest part of this because, that's the thing that I've avoided for most of my life is, being in the moment, because those times when I was in the moment, I was being harmed. And so whenever I'm in a situation that I feel that way, there's an automatic kind of like turn off. And as my, spiritual coach says, it's just, you're just learning how to work that muscle. You're learning how to work that muscle.
Yeah.
We've got our tools here. She said there's still a lot of releasing that needs to be done, and that it's just a process. It's an uncomfortable process, but there will be a point that it will be a rare thing that I would either get re-traumatized, or that I wouldn't have the tools that I need, or, my spiritual guidance, which is important to me to help me walk through these. I mean, years ago, I don't think I could have done this work, because I always say it's hard, but it's painful.
Mm-hmm.
It's painful work. But as I get better at it, I can feel a little more joy, a little more happiness, knowing that things can change, for the positive. Brought new people in my life because I've raised my energy.
Mm-hmm. You're bringing different people into your life, whether you realize it or not. And when you were just talking about like working through it, it kind of, trauma is obviously can be compared almost to grieving.
Yeah.
And my favorite grief counselor, his name is Alan Wolfelt. I've read so many of his books, and he talks all the time. And when you just said that you can't go around it, you have to go through it.
Yeah.
And it sounds so simple, but a lot of people choose to go around it.
Right.
And I think you probably did for many years.
I did.
But now you're choosing to go through it, and it's paying off.
It really is. It really is. And
as painful as it is.
Yes. Forgetting actually what happened when I was in the ER. So I'm talking to my coach, and we're just kind of talking through things, because I just had a lot of anger going on. I was angry at people who didn't respond exactly how I needed them to.
You mean from just medical?
Exactly.
Okay.
After all this happened, it's
Yeah.
like, okay, people, now this is what I need. Why can't you figure it out? But I think it was just anger because, a lot of times my family wasn't there for me. It's like you couldn't count on people. And I think, as she said to me, and I shared with the friend that I was upset with, is that I was just afraid that actually somebody is going to be there for me, but I felt like I couldn't trust it.
Well, I think a lot of people know that sometimes when you're afraid, it comes out as anger.
Yes. Yeah, that is very true. And so I'm feeling more relaxed the past couple of days, but without her guiding me, I was just like, I'm angry. I don't know why.
But so she was talking to you, and then you remembered what happened in the ER.
Yeah.
I mean,
Yeah.
I think that's
huge.
I mean, it kind of goes to show you that you never know when that trauma is going to rear up.
And that happens with working with her. It's like suddenly something will it's like it gets loose. It gets loosened up, as we're talking about things. And then that's when once I made that connection, I cried for a long, long, long time, because if I had overlooked that, that was a real healing going on during that conversation with her, and recognizing, oh my God, thank God, because I wanted to remember who the doctor was. And I actually, through my doctor's office, I got his name so that I can thank him, for taking
really
the time,
cool. Yeah.
to be with me, because he didn't have to do that.
Well, when you're thinking back on it in the emergency room, I mean, did he come in and did he make you feel like, hey, I've got time to listen to you? How did he help you?
Well, you're in your little bed, in
Yeah.
your little clothes, and I'm meeting the two nurses that are working with me when I first got in there. And, at some point they're telling you who the doctor is. But when he came in, I probably didn't have my glasses on. They were so busy with stuff. But he just said, hi, I'm Dr. blah, blah, blah. We're here to check on you. He did all the things to see if I had a stroke. And of course, eventually I had a CT scan. and an MRI.
Okay.
And it was the MRI that was the thing I did the last day I was there. But at that point, like I said, they were trying to get my blood pressure down. And then this event happened of get me the doctor and crying and telling him all this stuff. It's like I'm watching myself tell him this. I didn't understand why I was telling him that.
Huh. Wow.
I just didn't. I just did it because I felt like I was like, 8 years old. And again, now that I can look back, now that I was reminded, I could, let him know how I feel and what he did for me. No, he didn't have to spend that time because they're busy.
Yeah.
They're in and out,
But he must have responded in some kind of positive way.
He held my hand.
Uh-huh.
He's looking me dead in the eye.
Oh, see?
Because I am just all over. I'm a kid.
Yeah.
And he says, "You're safe. You're safe. You're safe." And it calmed me down, though I was still crying. But, he didn't have to do that. He's busy.
Well,
I'm not
so
a child.
thankful.
I'm an adult.
Right. But I'm so thankful that you actually, I don't think you had a choice with yourself, but you reached out when you needed.
Well, that was the child in me that didn't get what she needed. And I don't know if it was something about him that I felt like I could be safe with him,
I wonder.
As opposed to one of the nurses or anybody else. All I knew was I didn't want anybody else but him.
Huh.
So be sending him a card of thank yous.
Mm-hmm. That'll be one of the things that makes him know he's doing the right thing.
Oh gosh, yes.
So that's pretty nice. So not only did you have this medical emergency, but it brought up all these emotional things. So now you're learning as you go back and go through the whole process of what happened in those 3 days and 2 nights in the hospital.
Yeah.
How that's making you grow.
Yeah, I remember you said, because when I was texting you, I'm scared. What's going to happen? And you said at one point, she said, I really think this is going to help you bloom. And I had to think about that. I said, it helped me bloom. I'm trying to stay alive.
Yeah.
What the? But it's true. It's true. I've worked out a big piece of.
So, I mean, the logistical, you've learned a lot of, and I'm learning from working with you during this, boy,
Yeah.
The logisticals of, okay, everybody needs to have certain things in place.
Right. Before we talk about that, though, and I don't want to forget, is why did I have that high blood pressure? Why did I almost have a stroke?
Yeah. Yeah, I was wondering about that.
How did that happen? Yeah. Well, part of it is certainly my own fault. I'm on 2 blood pressure medications, and I've been on them for years. And I had picked up refills on both, and somehow I misplaced them. So one medication I was completely out of, so I figured, what's a few days? It was probably like 4 days. And then on the other one, I ran out probably for a couple of days. So for a few days there, getting these terrible headaches, but I just figured that it was sinus, and maybe it was. They can't really pinpoint exactly, what it was. So, not taking the medication, probably not drinking enough water. And then I was practically eating Advil to get rid of my headache.
Which was probably being caused from high blood pressure.
Yeah. Yeah.
Oh, wow. So that's an important piece.
Is a very important piece.
That you can't mess around. I mean,
and my doctor told me, because I'm telling him this and being honest, and he said, unfortunately, that's not unusual. He said 40% of his patients, if they've had something like mine or there's an issue with he gives them, what they need, the medication. And he said 40% don't follow his instructions.
Wow.
And that shocked me.
That's shocking.
I figured it was probably 5% of people wouldn't do that because you're kind of at risk. But then a friend of mine in DC, she was sending me information. She sent me an article about Tina Turner. I did not know that she had high blood pressure and at one point stopped taking her medication. she started on some homeopathic thing that a friend of hers recommended. And when she went back to the doctor, she had lost 35% of the use of her kidney. So she was off her medications, for years. She ended up on dialysis. Her husband gave her a kidney.
Wow.
Yeah, that saved her, and she lived several, years longer and was on the straight and narrow. But by that time, there was so much damage, having the previous stroke, being off that medication. And she joined the board of some kind of foundation in the UK about kidney disease.
Huh. Yeah, that's a real side effect from high blood pressure.
Yeah. And so I had no idea. And it was, and she was saying, don't do what I did. Don't risk your life because you think you know everything, or you think you don't need that, or somebody else says do that. Follow your doctors. And if you're not, at least tell your doctor what you're doing or not doing. Mm-hmm. I had no idea that, we're all smart. Like she said she was devastated by the news, but she realized, she said, I thought I was invincible. I thought I knew everything. The feel in her body, she said, was okay. But we know with kidney disease, you won't feel anything until it's bad.
Yeah.
And that's...
Well, and in your case, it was an innocent mistake. You're like, oh, what's a couple of days? Well, now you know.
I don't know. Yeah. I'll never, ever do that again. Yeah. No, because I do want to be here. I want to stick around.
So I guess at some point it would be worthwhile talking about these things we keep alluding to, putting in place.
Right. When I thought, one, I've got to drag myself across the floor to get my door open, I thought, nobody has a key to my house. If I couldn't get the door open, would they have to break the door down? And then having instructions in place where, you have someone that, your power of attorney, your will, all those things you don't want to talk about. But then also, with you, I'm going to give you guys a key, but I'm also going to give you names and numbers of people that would need to be notified.
Right.
And I'm grateful for that because there's no other way to do that. Mm-hmm. So, yeah, it brought up some serious issues and things that we have to be present and conscious about is how do we make sure that we're going to be okay, that we have people in place, that can help us. And even in the event of someone passing away and informing people, it's something that has to be done. Now, I know I'm in the middle of paperwork for all of those things. I just have to finish that process.
Yeah.
But I tell you, every now and then, I think if you guys were in town, because you tend to, whether you're taking care of your grandson or Greg's at your property mm-hmm. or, whatever you guys may be doing, that you just happen to be home.
Right.
Because I have other neighbors that, I know would be willing to help, but it would have been a burden, I know. And at least we had a close enough relationship.
Right.
Especially with you knowing the cats that.
Another good reason for people to get to know their neighbors.
Yes.
Which often doesn't help me, but that's a whole different
That's true.
podcast.
Yeah. Yes, it is. Trusting your neighbors. So. Yeah. But I thank you for everything you did for me. I thank Greg for just
being nosy
and what the hell's going on. I appreciate that too. Uh-huh. So again, I'm just grateful.
Yeah.
And you guys listening, I'll have some information on the platform about things that you should have in place, maybe some websites to go to. And I'll also attach that article about Tina Turner and what she went through and what she wants everybody to do to take care of themselves. See you later. Thank you for joining me today on Living in Midbloom. I hope you found this episode insightful, meaningful, and maybe it's given you something to think about. I invite you to share your positive reviews or ideas on topics you would like me to touch on by leaving your comments on Apple Podcasts, Spotify, Castbox, Podchaser, or Podcast Addict. We are all divine beings who just want to be seen, heard, and loved. Have a beautiful day.